off all of their medications if they went to do the LDN. All of them, yeah. I say if the prescription drug's working for you, stick with it, if that's what you like. We don't suggest anything to anybody. We are very objective. We tell everybody to stay with their rheumatologist or their oncologist, and there are several oncologists that I work with now and very interested in what I'm doing. The rheumatologists sort of get angry if they, the ones I know, if they get better on LDN. But before I see them, they have to be unhappy with their standard treatment. I think most people that are sick are deficient. And one of the reasons I stopped doing it, I used to do all of these exotic tests at one time, which were very expensive to the patient. And then they'd blame me for them spending so much money. And now I just do standard tests, usually that are that people can collect from their insurance companies on. I always do a vitamin D level. I think that's very important. A C-reactive protein, a homocysteine level. We could easily correct homocysteine levels with B-complex vitamins, and we could easily correct vitamin D levels with oral vitamin D.
One more question regarding what's the absorption rate on oral versus IV? Is 20% oral absorbed, is 50%, or do you know?
Okay, if you take a good lipoic acid product, within 15 minutes you'll smell it in your urine. It'll have an asparagus-type smell. And everyone absorbs it. Everyone. I think it's absorbed in the stomach. It's gets right into the bloodstream almost immediately, and you'll smell it in the urine within 15 minutes.
And your 15 milligrams per kilogram, is that per day?
15
micrograms.
You know, I can't give you any specific dosages because I don't know the patient. Everybody's different. Yes, sir.
Can I ask if there's any brands of products that you like?
Yes, but I won't tell you what they are. Just make sure that you ask your vitamin company if it's European prescription grade. I was once asked to write some articles for R-form lipoic acid. And I asked the magazine, it was actually several magazines, but I'll talk about one case. And I also asked the manufacturer of the R-form 3 questions. The first question, you know, lipoic acid, most lipoic acid, prescription lipoic acid in Europe is R plus S form, the synthetic plus the natural lipoic acid. The 3 questions were, number 1, do you use the prescription product as your initial raw powder, or do you use some industrial product from Asia? Number 2, how do you separate the R form from the S form? Do you use toxic hydrocarbons? And if you do, are there residues of this toxin in your final R product? Number 3, if the R form is so great, and I think it is theoretically, why is the prescription drug in Europe still the R plus S form? And I've done some work for the company that produces it in Europe. Years ago I received a grant from them. And I went on a lecture tour for Ostamedica, who originally produced it. And they told me that it was very difficult. They actually owned the patent for our form. Very difficult to get the chemicals that they separate the R form from the S form out of the R form product. That's why they still use just the original R plus S, the racemic mixture. That's why I don't use R form lipoic acid in my practice. The important thing is make sure that who's ever making this stuff is getting it from Europe, and it's, I think R plus S is best. It's cheaper, and all lipoic acid, that's good lipoic acid, is absorbed very high in the digestive tract, and you can smell it in the urine 15 minutes to 20 minutes later. One thing, if you take oral lipoic acid, you must take B-complex vitamins with it, because lipoic acid depletes the B-complex vitamins from your body, and you need B-complex vitamins for various methylation cycles. And if you don't have that, and you take too much lipoic acid, you might possibly cause DNA damage and mutations, and maybe cause cancer.
Would you need to be under a doctor's care?
I believe so. And you have to have a doctor who knows what he's doing. Yes.
Concerning the use of LDN with ulcerative colitis, I've seen various publications talking about 4.5 milligrams as the standard general dosage. In other places, they talk about starting at a lower dosage, such as 1.5 milligrams per day, and then bumping up. What's your recommendation?
Well, it depends on the person. You know, we usually start at 3 milligrams at bedtime, but then some people will complain that they have insomnia from this, or they have wild dreams that keep them awake or wake them up. So we'll go to half the dose, 1.5 milligrams at bedtime, and when they get used to that, we'll go up to 3 milligrams. And then, if they can handle it, 4.5. My patients, there's no set protocol. What I do is I tailor the protocol to the individual patient. This becomes complicated. Lipoic acid, in order to get it into a parenteral solution for intravenous or IM dosing, you have to dissolve it in an alkaline solution, and often the solution is sodium hydroxide. Then you have to buffer it down, because lipoic acid in an acid environment precipitates. It won't dissolve in water. So the normal compounding lipoic acid for intravenous dosing has to be injected into a bag of D5W or normal saline or lactated ringers, at least 100 to 250 milligrams. Otherwise, you're injecting an alkaline solution in somebody's blood vessel, and you can cause very serious problems. And I just got off a coroner's committee where somebody had killed somebody by injecting lipoic acid into their bloodstream without diluting it.